The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Welcome to Mindbind, the mental health show presented by Ontario Shores Centre for Mental Health Sciences. I'm your host, Daryl Mathers, and today we are talking trauma and mental health. Trauma is a term used to describe the challenging emotional consequences that living through a distressing event can have for a person. Traumatic events can be difficult to define because the same event may be more traumatic for some people than others. It has been estimated that 76% of Canadians will report having experienced a traumatic event during their lifetime. To talk more about trauma and its relationship to mental health is Dr. Phil Klassen, Vice President of Medical Services on Ontario Shores. Welcome, Dr. Klassen.
Thank you.
Let's start off by talking about trauma and its relationship with mental health. How does trauma impact mental health?
It probably makes sense just to make a bit of a distinction between capital T trauma and small t trauma. We all have negative life experiences that cause us distress. And then there are traumatic events that meet criterion A for post-traumatic stress disorder, events that pose a serious physical or psychological threat to the person. The former we expect, and many people are resilient and adaptive and can manage the distress associated with negative life events or small t trauma. As you rightly pointed out, the majority of people actually will face at least one capital T trauma kind of event in their life, and not infrequently more than one. And again, the majority of those people are able to be resilient and manage that. But those traumatic experiences are known to contribute to a number of different mental disorders. Obviously, post-traumatic stress disorder, PTSD, but also other mental disorders, because we're recognizing that there's an interaction between a person's genetic makeup and their life experiences. And so different kinds of traumatic experiences at different points in a person's developmental continuum, their age, may contribute to depressive disorders, anxiety disorders, possibly even psychotic illnesses. So the effects can be far-reaching.
In terms of treatment, you mentioned a number of disorders and maybe symptoms associated with somebody who's experienced trauma. How can trauma be treated effectively in terms of managing a person's mental health?
Many people that have experienced repeated traumatic events may have multiple mental health conditions at the same time. Certainly we see that in the in the trauma clinic. So one of the things that you may want to, if you're presenting for that kind of treatment, talk about with your clinician is, how do we sequence those treatments? What comes first? Because many people with traumatic illnesses may have an addictions problem of some kind, substance misuse. They may have problems with depression, anxiety, etc. That being said, there are really effective treatments for all of those things. There certainly is effective treatment for post-traumatic stress disorder, PTSD, particularly cognitive processing therapy and trauma-focused cognitive behavioral therapy. They tend to produce good outcomes in the majority of people that are so treated.
Why is it that we're hearing more about trauma today, not just in terms of maybe in the mental health world, but just in terms of societal's view? Like, why are we learning or discussing trauma more?
That's a good question that may be outside the ambit of a psychiatrist, because it's sort of a social kind of process that's going on. I do think we're trying to better understand not just what's wrong with you, if I can put it that way, but how did you get here? How did you get to this place? How is it that you feel this way now? And I think that over the last number of decades, researchers have repeatedly found that traumatic events are part of how a person got there. And of course, traumatic events are potentially preventable. And so if we pay close attention to trauma, if we minimize childhood adversities and other kinds of traumatic events, we may be able to change the course of mental illness in the future.
When somebody's experienced a traumatic event, maybe an obvious one, whether it's a car accident or some type of tragedy, Are there steps that they should take in terms of managing their own self-care, and so they can try to limit the impact of that trauma?
It's an excellent question. It's a constant tension in the process of trauma treatment. Most people will not develop PTSD after a traumatic event, but we're not good at predicting who might. And most people that develop PTSD recover spontaneously, but we're not that good at predicting who might not. And those individuals that do develop PTSD, and where that PTSD may be lasting, ideally, we would treat them early. But there are a lot of people that come forward for trauma treatment. So the piece that we're trying to figure out is which people can simply recover on their own, and which people really should be taken into treatment, because early treatment does tend to prevent or help prevent longer-term poor outcomes.
What about in terms of timing? And you often hear people who have PTSD that they've struggled for a long period of time before getting the help they need. If you're able to identify that sooner, is the road to recovery like smoother, shorter, or is there benefits to identifying that earlier?
There are benefits because the person isn't suffering for all that time. I want to make sure that we communicate that even if a person has had PTSD symptoms or even PTSD proper for a significant period of time, they can still have a good outcome, absolutely. On the other hand, the main benefit is that PTSD or significant post-traumatic symptomatology can have a really negative effect, obviously, on a person's life course, their trajectory, and the people around them. So if somebody's identified as having PTSD, then treating them obviously has huge benefits.
What about for the people living with people who are experiencing trauma or have experienced trauma and might be suffering? How can we as family members, friends, be supportive, understanding, like what should we look out for? Are there things that would help us in terms of caring and living with somebody who has been impacted by trauma?
I suppose it would help for the person, the carer, the family member, to have a sense of what are the symptoms of trauma. We think of PTSD, and of course we can read those symptoms online. People that have had more protracted developmental trauma have something called complex PTSD, where the symptoms are again a little bit different. So I think the first step might be for the family member or carer to learn about what those symptoms are, and perhaps in particular how they manifest in that person, and then how to help that person to best navigate those symptoms, at least until they get treatment and the symptoms are reduced. Recognizing that the symptoms that can come from a traumatic event or a series of traumatic events can be quite different. People can present quite differently, so it's important to get the input of the identified sufferer themselves.
In terms of Ontario Shores and its work in this area, what do we offer to people and families who may be struggling with trauma?
So we have a traumatic stress clinic at Ontario Shores where we offer cognitive processing therapy, which is the therapy with the strongest evidence base for the treatment of PTSD. We know that with this therapy, more than 80% of people will experience substantial and meaningful reduction in their PTSD symptoms. We know that from the literature on this therapy, and we know that from measuring the outcomes in the patients that come to Ontario Shores. We also have a first responder clinic for persons suffering from PTSD, similar kind of therapeutic process, slightly different pathway. If other kinds, and I mentioned earlier that you can have other diagnoses that come with PTSD, depression, anxiety, addictions, and so on, we also can refer to other clinics. We can arrange for a consultation with a psychiatrist in the event that the patient wants to have a discussion about medication. So there's a range of options, but the core treatment is cognitive processing therapy.
Thank you, Dr. Klassen. The mental health conversation continues as Julie Van Herningsveld welcomes our own Allison Stevens to discuss the Recovery College at Ontario Shores. That's coming up next.
Closed captioning is brought to you in part by Raven Reads. Unbox Indigenous voices. Subscribe today at ravenreads.org.
Welcome back to Mindvine. I'm your host, Julie Van Hardingsveld, and I am pleased to welcome Allison Stevens from Ontario Shores to this episode. Welcome, Allison.
Thank you.
Thank you so much for joining us.
It's nice to be here.
Excellent. As we get started, I'm hoping you may share with us, what is your role at Ontario Shores?
So my role at Ontario Shores started about 19 years ago. I started as a mental health nurse, and I've transitioned into various programs since. So currently I oversee our recovery college and our peer support department, as well as our therapeutic recreation team.
Excellent. So today we're going to talk about Recovery College. What is Recovery College?
So Recovery College is a program that complements but doesn't replace traditional mental health services or treatment. The reason it's called college is because it really is similar to a school in that we offer 3 semesters per year with courses ranging from one-day workshops, 4 weeks, 6 weeks, 12-week long courses, all about mental health and wellness. So it really is anyone coming together who has a shared interest in learning about mental health and learning about strategies to manage their own wellness or support others that they may be caring for. So ultimately, I think the most special part of the Recovery College is that all of our programs are co-developed and co-delivered by people who have both professional and lived experience with mental health. So all of our course content is very comprehensive and really represents a lot of various different perspectives and views of our students.
So you mentioned course content. What courses are offered through Recovery College?
So we have a really big array of courses. Ultimately, we want to make sure our courses are meaningful for our students. So each semester we work really hard with our student groups to understand what their needs are. So we have courses in 5 different categories. So one is learning about mental health and treatment options. So in that category, you might find courses about, it wouldn't be treatment, but it would be learning about it. So something like what is cognitive behavioral therapy or what is recreation therapy. So it really helps our students to choose to learn about different treatment options and then make informed decisions regarding their care. We also have leisure health and wellness programs, so things like really fun, like yoga and art cafe and opportunities for people to try new things. We have vocational programs, so things like navigating return to work, or we have a course called Group Facilitation Skills Training, which is a course that we've developed for any of our students who want to take a leadership role, empowered to feel that they can share their expertise as well in the college, so that's a prerequisite. And really helps to set them up for success. We also have courses on skills building, very important, things like coping with anxiety, managing depression, mindfulness strategies, things of that nature. And then we have another category which is about self-discovery. So part of recovery is just rediscovering or discovering yourself after mental health diagnosis sometimes, or after family mental health diagnosis. So we have courses in that domain about like telling your story and making sense of what's happened to you. Also courses like pursuing dreams and aspirations. How do we goal set together and learn together?
It sounds incredible. You mentioned the word students. Who typically are students of Recovery College?
So when we opened, initially it was anyone who accessed services at Ontario Shores, but we're really excited to share that we are now open to anybody across Canada. So we have students ranging coast to coast. So we've been able to do that because of our response to the pandemic. We've gone to a virtual platform, so obviously being able to open more access in that way. But anybody who has a shared interest in learning is welcome in the Recovery College.
Oh, excellent. And you mentioned you offer both in-person and virtual classes?
So pre-pandemic, we were 100% in person. Post-pandemic, at this point, we are 100% virtual with a small subsection of courses that we offer in hospital to our inpatients. But the feedback that we receive from our students is so important, and what we've really learned is post-pandemic, as we move into a more normal time, we'll have a blend, so a hybrid model where we'll have primarily in-person courses at the hospital or in some of our community satellite centers, libraries, and so on and so forth, but also we'll definitely still maintain those virtual courses to make sure that we can provide access as far as we can.
Excellent. How often are the courses offered?
So we offer courses right now Monday through Friday, very similar to school, but we are working on some evening offerings this upcoming semester, as well as we're working on developing some specific courses for families and caregivers, sort of a different stream within the Recovery College, which we're looking at offering some different timing, weekends and so on. And again, they run all throughout the day and early into the evening.
If someone was interested in participating in Recovery College, what type of time commitment would they be looking at?
I think that's what's so unique about the college is there's no one-size-fits-all model. We have students who are in courses every day of the week. We have others who are a little further along, sometimes in their own recovery journeys, who have, are working full-time and can maybe join us only on a Tuesday evening for a specific course, and that's okay too. So there's no sort of sweet spot of what you need to attend to see benefits. It really is whatever works for you. We want to work together to make it work.
Excellent. What do your students share with you about their experience at Recovery College?
I think that's the most rewarding part of my job personally, is I get to engage with students all the time and hear their stories. But what we hoped to see when we were looking at implementing the Recovery College was increased sense of connection and hope, and providing an opportunity for identity outside of someone's mental health diagnosis, and reducing isolation, and providing a place where people could try new things and so on. And I think we've been really lucky to hear that those stories are really, that is what we hear essentially. But some of the really moving things that we hear from students is that they've found a place where they feel like they belong and are accepted. They find, opportunities to, learn about things that they love or learn about things that they hate, and that's okay too, because they've learned something at the end of the day. That really, it's that sense of connection. I always say it's the culture of the college that's so powerful. It's that opportunity where we create that space where everyone's their own expert and everyone has their own expertise by their own experience and can share something with someone else that might help build their own sort of toolkit of strategies.
Belonging and acceptance and connection is so important. Thank you for sharing that. If someone is interested in registering or learning more about Recovery College, what's the best way for them to do that?
So I would say if they're interested in learning more about Recovery College, coming to our website at www.ontarioshores.ca, and just in the search bar you can put Recovery College and you'll find us. Right on our webpage you'll see some testimonials from students. You'll see information about how to get involved. Currently it's just a phone call into our peer support department, so you'll be reaching someone on the other end of the phone who has their own lived experience with mental health and has either accessed the Recovery College or is a facilitator in the college themselves, who sometimes we have people call and they've already got a list because they can access them on our website of what they were interested in taking, and other times we'll set up some time to have a more dialogue about what their goals are and how we can kind of point them in the right direction of what courses might help them meet those goals.
So anyone looking for more should visit www.ontarioshores.ca, type in Recovery College, and all the information they need to access more information or become a student of the college is available there.
Absolutely.
Excellent. Thank you so much for joining us today, Allison.
Thank you so much for having me.
Great.
Okay.
Hi, I'm Constable Gerald Rice, Durham Regional Police Service. Tune into Rogers Cable 10 to watch me on Seniors Talk with DRPS, where we'll talk about all kinds of amazing information and community programs for you, our seniors in Durham Region.
When it comes to mental health, we all have questions. Same is true when it comes to Ontario Shores and the services we provide people impacted by mental illness. That's why we are proud to present Ask Ontario Shores, an opportunity to have your questions answered by staff, volunteers, and patients from Ontario Shores. Whether it is a question about symptoms, treatment, or directions to our main hospital site, we are pleased to provide you with a chance to learn more about Ontario Shores and mental health. If you have a question you would like answered by Ontario Shores, send it by email to communications@ontarioshores.ca, and it may be included in a future episode. Now I hope you enjoy this episode's version of Ask Ontario Shores.
I think it's important, but it's not. I wouldn't say it's critical. I think that any support is necessary. I think that individuals who have family support, great, and we should support that and amplify that to the extent that the individual desires that. Other people may not have access to family support, so there may be other mechanisms of community-based type of support or peer support or getting people connected with their community or with things that they're interested in. So I don't think we should say it's exclusively necessary to have family support, although I think it can be very helpful for many individuals. I think recovery is a lifelong journey. I think there's going to be ups and downs. It's not a straight path, or what some would say a linear path. There's going to be a windy road, if you want to use that analogy. So I think people have to understand and be able to take things in stride and look at the longevity and the big picture. I do think that people should celebrate achievements. They should recognize when they've achieved some personal growth and development or achieved some stability in their life. But overall, it's a lifelong investment to support an individual's recovery.
Doctor.
I recommend going to an urgent care walk-in clinic and asking for a family physician there to do a referral. You can also go to emergency services. I wouldn't recommend going to the ER, but if you're really struggling and having a difficult time is going to the hospital, the physicians there in the ER and the psychiatrists on call can also complete referral forms to our hospital.
Ontario Shores primarily serves sort of Durham region, York region, the Kawarthas, up into Peterborough, Northumberland, but we are actually a provincial resource, and so anyone from across the province can call into our sort of intake line, and we'll be able to serve them. You know, we have a wonderful inpatient program, but we also have a considerable number of outpatient clinics. And there are specialty clinics as well as general clinics. So a specialty clinic might be something like our psychosis clinic, and our general clinic might be something like our prompt care clinic. And so we offer a full range of both outpatient and inpatient services.
The staff at Ontario Shores are really second to none. They are extremely invested in patient welfare. I can speak from personal experience, and I was treated so well and so warmly and encouraged and empowered. And so there hasn't been a staff member that I've met at Ontario Shores who isn't invested in the whole process.
I think a lot of support. So I would say consistency for mom and dad or parents, just being there, being open to hearing and talking to them about what's going on. I would say awareness in the schools, so guidance, teachers are huge facilitators of information, but also of support because they're with our kids a lot longer than we are as parents. And then I would say try to get some supports in the community, safe space where they can just talk and be and discuss what maybe they don't feel as comfortable discussing with parents. I think teenage angst is a lot more short-lived. So like a bad day, for instance, is exactly what that is. A bad day, a bad 2 days, bad week. But mental health is longer than that. Mental health tends to affect functioning, so you'll notice changes in abilities to attend school, routines, eat, sleep, withdrawal. Like you'll just start to see shifts that are a bit more long-lasting, I would say.
Hi, I'm Sean Lackey, and this is Sold with Sean Lackey. You should check us out if you want to find out what's going on in the world of real estate. We'll have all sorts of guests to keep you in the loop on what's going on in this wonderful world.
Recovery is embedded in everything we do at Ontario Shores. Recovery from mental health can also mean different things to different people. Each episode, we are proud to bring you Recovery Moments, a segment where staff, volunteers, patients and families, and community members highlight a recovery experience from their personal or professional lives. Recovery Moments inspire our staff to keep making a difference. Here are this episode's Recovery Moments.
My recovery moment is the satisfaction that I feel in being able to help other staff in developing some comfort in using some of the skills they have in helping some of our clients. In this last year or so, our hospital has been rolling out a program of cognitive behavioral therapy for psychosis. And so we have a lot of clinicians who have been learning the skills and trying to help individuals who are hearing voices and experiencing other symptoms related to psychosis, and a lot of things that are really new to staff. And so the hospital had asked me to provide some consultation to groups of therapists working in the program that I work in, and it's been really satisfying to help people gain that level of comfort and go out and do some things that they hadn't been doing previously.
My recovery moment was one time when I was working with a client who came to therapy to be treated for anxiety and depression. This client had a hard time getting out of bed or completing her activities of daily living, such as brushing her teeth or taking baths. Initially, we started doing our sessions virtually, but after a while, we decided to do our sessions in person because it was a great opportunity for her to get some exposure. We used the grants of Ontario Shores as part of her behavioral activations. She was getting out of her bed and coming to her appointments, and the client started doing slow improvements. After a while, the client started doing other things that she enjoyed to do. But I remember this time when the client came to my office and asked me if I wanted to hear a list of things that she has been doing since she joined therapy. So I was really thrilled to hear the list. Some of the things that she shared with me, it was that she was able to get out of the bed and follow a routine. She was cooking healthy meals. She also joined Recovery College, and she learned how to do some hobbies such as horticulture. She was meeting with friends, and she was able to follow up with her doctor's appointments. Of course, I was really proud of my client, and I let her know that it was all because of her hard job, because she was putting into place all the strategies and techniques that we have been learning in our time together. These are the times that I remind myself why I chose to be a psychotherapist. These are moments like that happens in life that I remember what I like to continue giving hope to my clients and helping them in their recovery journey.
I'm Eric Marchinosa's Cinema Scene in Review. Join me for a monthly movie roundup of new releases either in theaters or available to stream. See you next time in Review.
Thank you for watching this episode of Mindvine.
If you are in crisis and require emergency services, please visit your closest hospital emergency room or dial 911 to reach emergency medical services. For more information about mental health and the services provided by Ontario Shores, please visit ontarioshores.ca/gethelp to learn more.
If you have a mental health story you would like to share or have recommendations for a topic of a future episode, please contact us by email at communications@ontarioshores.ca. Thanks for watching.